lead Kriya University. And we had the keynote address by the well-known educationist as well as specialist in this area of monitoring and evaluation, Dr. A.K. Shivakumar, is economist and policy advisor. Following that, we tried to capture myself onto the conceptual background of the YEE program and objectives of the training program as such. Then the basic understanding of the concept of evaluation was covered by our chairperson, YEE-SA, Cheladure Solomon. Then the role of young and emerging evaluators in the process of evaluation was covered by Rashmi Agrawal. She is the co-founder and co-leader at ICOI, India, and co-chair of IRIPE. Concluding remarks were made by Aniruddha Rambrahmachari. As I said before, he is head research operations, lead Kriya University. And finally, I concluded with a vote of thanks to the resource persons and all those present. Today, we have the great pleasure in initiating the second technical session. And with the little recap that I covered last time, we are in for two interesting presentations. But before that, I'd like to introduce Dr. Jagadish Chandra Prokal. He is board member YEE-SA. And of course, at the beginning, I hope you would announce yourself a little bit about your experience in the government sector particularly, because this is not just NGO sector, it's government, NGO, as well as private sector. We are addressing all those concerns. Can I hand over to the moderator, Dr. Jagadish Chandra Prokal?
Mallika ji, thank you very much. Thank you and welcome everybody. My name is Jagadish Pokhrel. I am Vice Chair, as Mallika ji said, of COE South Asia. I have experience with government services. I used to serve as Vice Chair of National Planning Commission, and my area of interest happens to be evaluation, monitoring, and so forth. I'm still a student, so I'm so happy to join the young and emerging students here of evaluation sector. Mostly I do planning, and I serve as an independent consultant and teacher as well. I will now move. Is it okay?
Dr. Jagadish, can I have just one moment?
Please.
I think I missed mentioning, though in my hearts of hearts and before the session also, I was welcoming the two presenters. That is my friend Dr. Zonal Zaveri, board member YEE-SA, as well as he's the GENSA coordinator. And then about ethics in evaluation, another significant sector in this area, will be presented by Mr. Alok Srivastava from the Center for Media Studies, New Delhi. Then of course we have corresponding questions and answer sessions after each presentation. Thank you. I'm sorry to have disturbed you right at the beginning.
You did my job. Thank you so much, Mallika. Without much ado, I think I will put a few ground rules and request the presenters to move ahead. One, all the participants, you are requested to put your comments, suggestions, questions, whatever you have in the chat box so that we have it recorded and we can respond to you. And also encourage you to remain throughout the session because I can understand how the first session and this session is linked and other sessions will be linked also. So at some point we should feel confident that the participants have participated truly in these sessions, and I'm sure you will benefit out of it. Without much ado now, let me request Dr. Sonal Zaveri to make her presentation, there are two sections, important sections that she is going to speak about. It is about introduction of the whole concept and then usefulness of evaluation. She will take about 40 minutes if she wants to. Otherwise, she can actually start.
We have allocated 40 minutes, but she can.
Yes, you can always limit
Yes.
whatever you want to. Okay. Dr. Javeri, please go ahead. Thank you very much. You have 40 minutes.
Thank you. Thank you for that kind introduction. And just before I start, just a little bit about myself. I, as you know, am also a founder and a board director of the Community of Evaluators South Asia. I'm also the coordinator of GENSA, the Gender and Equity Network South Asia. I'm sure many of you know about it. It's the regional network, a special interest group in the Community of Evaluators South Asia that's specifically addressing gender and equity. And as you may guess, I will be talking about that in the evaluation criteria as well. Beyond that, I also hold several international positions, but the one that is most relevant to this presentation is that I'm also the co-chair of EvalGender Plus. So thank you everybody for coming to this webinar, and I sincerely hope that the learning from this will be carried over to the work that you do. As mentioned, we will be having a very interactive session. Make sure that you have your chat box open, and let's get started. So as mentioned earlier, we are going to talk about evaluation criteria. And in the introduction, we are going to talk about what it is, as well as how we can use it and how we can move ahead and also apply it to gender and equity. I hope everybody can hear me clearly. If there is any issue, please mention in the chat box. Okay, so moving forward, how am I going to have this particular presentation? Right. So I'm going to start by first providing an understanding of what is criteria, why do we need criteria in evaluation, what are the main evaluation criteria, how are we going to use it? So we're going to have some application as well, application of criteria for evaluations, and how can evaluation criteria be gender? As I mentioned, we will talk about gender and equity as well, and we'll be having discussions and Q&A as well. Okay, so moving forward, just a few housekeeping. I know that this has already been discussed, and
Is there a problem with sound? Sonal, you have not unmuted.
all right, sorry for that. I'm going to begin again about the housekeeping. So kindly introduce yourself in the chat box, your name, which country you have come from, and also to talk about which organization you belong to, so we get to know you better. All right, so having done that, also I'd like you to please use the chat box for your comments and queries, and they are going to be collected as we move forward in this presentation, and we will have them at the end of the session. We are going to have polls, word clouds, and lots of exercises during the webinar. So please attempt them honestly. We are here to learn together. And of course, kindly mute yourself while the presentation is going on. And if the bandwidth is low, kindly switch off your video. All right, so What are criteria? So if we look at criteria, we are using them everywhere in our lives, and they are a principle or a standard by which something may be judged or decided. And we do that all the time. So we have a criteria if we are buying something, if we want to go to a certain place, we use that all the time. So those are general criteria. But what are evaluation criteria? So let's check our understanding, and we are going to have a word cloud, and I'm going to request Rajshi to post the Mentimeter in the chat box, and you'll see the link. Kindly put the link in, Rajshi. Rajshi is helping us with this presentation, and you will have 30 seconds to write all the words that you associate with evaluation criteria, and then we are going to review that in real time. So Rajshi has posted it, and I'm going to stop the screen share, and please go ahead. You have 30 seconds, so be quick. And Rajshi, when you feel that most have completed the Mentimeter, kindly share the results. 30 seconds. Okay. All right. So we have a few which talks about, and we're getting more as they come in. Okay, we see a lot of effectiveness, measuring, analysis, outcomes, relevance, impact, specific, coherence. I have a very knowledgeable group that I will be presenting to. Thank you. Indicator. Okay. Well, let's take up the question of indicator in the Q&A. And we'll talk about whether they're part of the evaluation criteria or not. So whoever has written that, please remember to discuss that in the Q&A. Then we have outcomes, okay? Outputs, excellent. So let's close the Mentimeter now. And I'm going to start sharing my screen again. Just a minute. Okay. Can you see my screen? You can see it? Perfect. Thank you. So we had an understanding of what we understand as evaluation criteria. So let's go ahead and explore this a little further. First, let's think about why do we need evaluation criteria? So this need for the evaluation criteria arose from a definition of evaluation that has been around for a long time, in which it said that evaluation is an assessment to determine the relevance, the fulfillment of objectives, developmental efficiency, effectiveness, impact, sustainability of efforts, supported by aid agencies. Now you will see that the language is a bit different because it's coming from 1992. So let's go to poll number 1. Rajshi, please share. You'll get 30 seconds again, so be quick. I hope everybody can see the question. Right, we've got 15 out of 51%, please. We've got another 10 seconds before we close the poll. Wonderful. All right. We got about 72% of responses. Thank you, everybody. So what we see is that a large number of you do know about it, more than 50%, and 14% somewhat, and 30% don't know it. Okay, so let's hope that I'm able to present the criteria in a way that is understandable to all. And as I said, kindly, please share your questions and queries in the question box. All right, so moving forward. If you could stop sharing that, please, Rajshi, so I can move on. Okay. Now, the evaluation criteria, to give you a bit of a background, were first developed by OECD DAC in 1991. And they were defined in 2002, and that tells you a lot about how much of work was done in trying to understand how are we going to guide evaluators and how do we do that globally. So initially, 5 original criteria were used worldwide. And that was the focus on relevance, on effectiveness, efficiency, impact, and sustainability. And a number of these were mentioned by you when we did the Mentimeter. So let's try to understand how much more do we know about it. Let's go to poll number 2. Please share, Rajshi. What does DAC stand for? Come on, quick. A few more to go. Another 10 seconds. Doesn't matter. Whatever you can think of, just put it in. Okay, I'm going to try to hit 70%. So quickly, can we get some more answers? Excellent. Almost there. Okay. I think we can stop and end the poll. We're at 66. Yes, it is Development Assistance Committee. 70% got it right. Excellent. Excellent. Let's go to the next poll. Rajshi, could you share that, please? The DAC criteria was developed in 1991, and we are using the same criteria today. Is it yes, no, don't know? All right. Almost there. A few more to hit higher than 63%. Are we using the same criteria today? Okay, let's stop the poll. I think that's pretty interesting, the answers, and let's see whether we are or we are not using it. Thank you. Okay, so now let's move on. Well, there was a new DAC criteria, and that started in 2017. And there was a demand at that time to adapt to the criteria because there was a changed landscape. As you know, the SDGs were formed, and the 2030 Agenda, Sustainable Development Agenda was in place, and the development landscape had become very complex. So So did the criteria actually respond to something that is almost 20 years old? And so there was also a demand that do we really understand what we mean by relevance and efficiency and so on? And so there was a quest for improvement. So after 2 years of global consultation, and let me tell you, it was really, really extensive. It was both public with different groups and all of this analysis with more than 1,000 people. The OECD DAC came up with some new criteria. Let's go to poll 4. Okay, how many new DAC criteria were added? Come on. If you don't know, take a guess. Wonderful. Almost there. All right. Okay. Let's close the poll. Let's close the poll. We are at 76%. All right. So I want you to see these answers and you will know how many there were, 1, 2, 3, or 4, as I go to the next slides. Thank you very much. All right, moving forward. So what happened with the new and improved DAC criteria was that there was a better response to equity, gender equality, and the leave no one behind. The second important change that the DAC criteria made was supporting of use. Ensure findings have wider applicability. And so you know the answer to that poll, one major new criterion was added, and that was coherence. And coherence, because of the Paris Agreement, because of the SDGs, we needed to capture synergies, partnerships, and the complexity with the original 5. Now, the purpose of this evaluation criteria was the same as it was earlier, to have high quality and very consistent evaluation, but to also have a common framework. And by having that very consistent language, you could provide standardization, you could compare, and you could also learn across different interventions. So what do these criteria do? Each of these criteria give us a lens. So if I look at relevance, it gives me a certain lens. If I look at effectiveness, another type of lens. It gives me a different perspective. And it gives us a perspective for both implementation and results. So it does the entire gamut of the theory of change. And together it gives you a complete picture of the evaluation. Now these criteria, although separate, are complementary. And they also encourage us to very deeply think about what is the nature of the implementation, how the processes are being conducted, what are the results. Very, very important. They prompt us to ask the right questions. And it's key that we need to do so during an evaluation. And of course, all our evaluations are not just about accountability, but they also support learning and they feed back into our findings and our lessons. So before I jump in, I just wanted to be very clear about the logic model, because we are going to understand where these different criteria fit in on this logic model. And while I'm explaining the criteria, please in your minds think about whether this particular criteria is at the front end, say when we have our inputs. Is it more applicable to activities? Is it more applicable to outputs, outcomes, and impact? So where does it land, the different criteria? Or is there something cross-cutting? So when you are hearing about the explanations about the different criteria, do keep this basic logic model in your mind, whether it's about your planned work and whether it's about your intended results. I hope this is clear. Again, if you have any questions and clarifications, please put it in the chat box. So the first criteria, and a lot of you have already mentioned it, is relevance. And very simply put, the question it says is the intervention doing the right things? The emphasis is on right. Now, I mentioned to you that the criteria has changed and they came out in 2009. So let's check whether you know which one has changed. Please read number 1 and number 2. I'm going to give you a minute to do so. And in the chat box, please share whether the new one is number 1 or it's number 2. I'm going to give you 10 seconds. Please put it in the chat box, number 1 or number 2. I'm not seeing any mention in the chat box. Come on, try. I have 1 from Puncho. Who else? Okay. Wonderful. All right, so we are getting a consensus over here. Let's see. Perfect. So the extent to which the intervention objectives and design respond to beneficiaries, global, country, partner, institution, you'll see that they've expanded the meaning of relevance to include many, many stakeholders, many priorities, and very important, they've added, continue to do so if circumstances change. And this is what I was talking about, that the development landscape has changed. We know how complex everything has become, how ever-changing it is. We know about our climate crisis. We know about the pandemic. So does the relevance continue when we planned it? Does it continue as we do the implementation? Excellent, everybody. So here are some guiding questions. How do we translate that in practice? So we can ask whether the objectives of the program are still valid. So if you're an evaluator, ask that, still valid. Are the activities and outputs, remember your logic model, the middle part of implementation, consistent with the overall goal and the attainment of its objectives? Are the activities and outputs consistent with the impacts? Think about the latter part of that logic model. So the relevance has to look at whether there is a logical understanding of why we are doing the evaluation. Let's move to the next one, coherence. This was the new one, and it addresses the question, how well does the intervention fit? Now, again, this is a new one, so there's no old and new. It talks about the compatibility with other interventions, and it does it at different levels, whether it's a country, a sector, institution. And it wants to know whether all of these come together to attain whatever objectives you're looking for. Remember, it addresses both internal coherence and external coherence. So let's look at the guiding questions. So the first one is, to what extent was an X organization's intervention coherent with the key programs of other partners? So this is about external coherence, but operating in the same context. And all of us who have worked in development know that one of our interventions is there among many. The second one is, what are the linkages between the intervention and other interventions of that same organization? For example, in COVID-19 relief, you may be doing education, you may be providing material support, you may be providing some health services. Are they all linked together and are they coherent? Or does one address one group and the other addresses the other group? So this is a very important question. Please do put your queries if you don't understand anything or have questions. Let's look at the third one, effectiveness. This is a very simple one. Does the intervention achieve its objectives? And I think all of us are familiar with it, but we have, again, two explanations, an old one and a new one. I'm going to give you 30 seconds to read this on your screen. And again, in the chat box, Which is the new one? Please put in the chat box. Wow. Thank you. Okay. Excellent. Wonderful. We have a very knowledgeable audience here. Absolutely correct. The extent to which the intervention achieved or was expected to achieve the objectives. Please note, expected to achieve the objectives and its results, including any differential results. See, the earlier one didn't have that. It was just one. Did it achieve objectives? But here we understand that results can be different across groups. So what are some of those guiding questions? Well, first one is the fairly simple one. Were the objectives achieved or likely to be achieved? And what were the major factors influencing the achievement or non-achievement? So we don't just stop and say, yes, you achieved, yes, you didn't. No, we have to, as evaluators, also discuss what are the major factors. Let's move to the efficiency. How well are resources used? So what does that mean? Again, there are two definitions. Which one is the one that you think is the new one? Please, again, on the chat box. Okay, wonderful, wonderful. Thank you to all of those who are very confidently putting their options in the chat box. Thank you. Again, excellent. So here we are looking at, yes, how does the intervention deliver? Again, likely to deliver in an economic way, but also in a timely way. This is very, very important. Did we deliver on time? Earlier, we only talked about in economic terms. It is an economic term, and we are looking at the least costly, but now we are also looking at the timeliness. What are some of the guiding questions? There are many, but here are two. Were the activities cost efficient? I think we are quite familiar with that. And was the project or program implemented in the most efficient way? So the efficient includes timeliness. Okay, let's move to the next one, impact. Simply, what difference is the intervention making? Anything that we do in our programs, we want to assess as evaluators, particularly if there is an impact. So what does that mean? Again, we have two definitions. Which is the new one? Please put it in your chat box, one or two. All right, thank you. Brilliant. Yes, it is the extent to which the intervention has generated or expected to generate significant, this is important, positive or negative, intended or unintended, and higher level effects. So again, you see a difference from the earlier definition. It's much clearer. What are some of the questions? And you can use any of these in your own programs when you're preparing your evaluation design. So what has happened as a result of the program? The program is done. What is the result of it? What real difference has it made to the beneficiaries? So in impact, we are really going down to that level and said, what change is happening in the lives of the beneficiaries? Now I'm using the word beneficiaries, but you can use whatever word you like in terms of target population and so on. Does the development intervention contribute to reaching higher level development objectives, preferably the overall? So very clearly it mentions that. Let's go to the last one, the sustainability. Will the benefits last? I think we all understand what it means. Again, let's look at this. Which one is the new one? Is it 1 or 2? Okay, we are finding I found a bit of variation, a little bit. All right, I will move ahead in just to make sure we are on time. It's the net benefits of the intervention continue or likely to continue. Please, now we also understand that not only should projects be financially sustainable, but environmentally as well. And again, there are a few guiding questions which are here, that after donor funding ceases, does the benefit continue? And what are those factors of sustainability? Because we want to learn from that, of that program or project. All right, now here, I hope you enjoyed this activity. I have 6 questions, and below you will find the 6 criteria. I'm going to give you 1 minute for you to read each of them and yourself note down whether it is relevance, coherence, effectiveness, efficiency, impact, or sustainability. Do it on your own. If you're brave enough, you can put it into the chat. Otherwise, do it on your own. I'm going to give you 1 minute for you to do so. If you need more time, just mention it. I'll wait for another 30 seconds. Is that okay? If you agree, say yes in the chat. Another 30 seconds. And if you feel that I can give you the answers, can you put your hands up so that Rajshi can tell me whether I can continue? If you're ready, put your hands up. You know the emoticon, right? Use that. Okay, 2 participants have raised hands. More? More? Okay. All right. While I'm speaking, you may also think about your answers. And if you haven't mentioned them, perhaps here is a chance for you to know about it. So the first one is impact. And whoever got it right, give yourself a big clap. Were objectives achieved on time? Efficiency. The third one, about implementation according to plan, effectiveness. The fourth one, sustainability. The fifth one, relevance. And the sixth one, coherence. If you have any confusion about any of this, we will check it when we have our discussion. All right, before I proceed, let me just have a few questions people have about the criteria. The first is, should we use all criteria in an evaluation? No, not really. You should use only those that are most applicable, and you may also have to add more. In what types of interventions can we use the criteria? Actually, anything that you're evaluating, whether it's technical assistance, policy, program, an advocacy project, anything that you are evaluating. So it's really flexible. Does the humanitarian setting have different criteria? Yes, they do have. They add on some criteria, and some of them are coverage, protection and security, coordination. And by the way, the coherence one came from the humanitarian setting experiences. How do we choose criteria if we have to? You must choose it on the purpose of the evaluation. Are we evaluating the process? If you are evaluating the process, there is no point looking at impact, no point looking at sustainability. If you don't have data available, then you cannot have certain criteria. So one has to be also very practical in the choice. How do we ensure gender and equity is included in the criteria? I'm going to give you a few examples as we move forward. And should the evaluation indicate progress on all criteria used? No, not necessarily. You can have a very relevant program, but if it is not implemented well, the effectiveness criteria will tell you it's not an effective program. Again, if you have more queries, kindly put it into the chat box. So let's look at engendering. I use the word engendering because how do you make the same DAC criteria gender and equitable? And we can do that and align it with human rights. We used to have another section developed by UNEG, which is, I will provide that in the references, that also developed these. But the DAC criteria themselves are excellent for engendering them, sorry. So it's going to help us to frame our evaluation questions. Remember, each of the criteria provides us scope to have the evaluation questions. So when we actually begin to engender these, what are we looking at when we look at gender and equity? We are thinking about equality, participation, empowerment, social transformation, and inclusiveness. And I think everybody understands that because we come from a development point of view. So let's look at a few sample gender equality questions when we look at relevance. So if you have a program that has to look at gender and equity, ask, was there gender analysis? Did that contribute to understanding the relevance? Did the project reach the disaggregated sex, age, race, ethnicity, and socioeconomic people? Did they identify them? The reach would be later, but did they identify them? To what extent were men and boys consulted when you developed the design of your project? Let's look at another one, effectiveness. When we look at that, we could ask, remember the definition also talked about the different groups' effectiveness. So here we can ask, did women and men benefit differently? What were the effects based on the gender relations between women, men, binary, LGBTQI, what was expected and unexpected? And this is a critical question, did the outcomes actually contribute to gender equality, or were they gender neutral or gender discriminatory? Then we look at efficiency. Again, some examples. And here we can look at whether the resources were spent on male and female beneficiaries. Very, very important. We cannot think that resources are neutral. And whether they were strategically meant to achieve gender-related outcomes. And when we look at resources, we look at funds, human resources, time, expertise, and so on. So it's a much broader definition of efficiency. So when we put the criteria together, what would it look like? So here is a summary statement that I really like. It says, all interventions ideally should be relevant to the context, coherent with other interventions, internally, externally, achieve their objectives that we had planned, deliver results in an efficient and timely way, and have positive impacts, hopefully, that last. And the last is the sustainability. So in one sentence, we can capture all the 6 criteria. So here are some references that you may want to refer to, and I will ask Rajshri to send this to all the participants if you require. So kindly write to her and we can send it to you as a separate email as well. So this is where I'm going to stop my presentation and open to question and answers from all the participants.
Thank you, Dr. Javeri. We are open for question and answer. We'll take about 10 minutes. Please go ahead. Raise your hands or put in the chat box. Participants, Do you have any question, Punjo? I have one question, Dr. Javeri. What made this the donor community to change the criteria? What was it? It was a lesson learned from developing countries where the aid was given. Was it because there was some kind of advocacy? How did it work? This one question I have. Then we'll move to our participants. I can see one hand there.
Yeah, it will be great if you can put your questions in the chat box. So we make sure that,
please.
Yeah, please type it into the chat box.
Chat box, yes.
Thank you. So as I'd mentioned earlier, it was about almost more than 20 years since the criteria was around, and the landscape had changed. There was better understanding of what development is. There were new development actors. There was an understanding that we require greater collaboration. Are we able to address that? There were certain gaps in evaluation. And although initially you were talking about programs and projects, the scope of evaluation itself had expanded extensively. So it could be a strategy, it could be a technical assistance. And so there was some thinking on whether we would be able to address these new issues. Very importantly, as the development field has matured, there were queries from the Global South, whether it was addressing all the issues in the Global South. I was part of the team that actually worked on the revision of these stack criteria and presented from the Global South at a couple of conferences on what are some of those issues that we want included. We were actually quite radical, and I must say everything that we recommended was not included. What we have found is that definitely we have the timeliness that was clearly requested, that we wanted to do that. We wanted other criteria which they didn't include, as I mentioned. One was innovation. We think that was really important when we are dealing with problems that have been around for a long time. And how do you, evaluate that? So there were many reasons for this change.
Thank you very much. There are a couple of questions in the chat box.
Okay, I'm going to look at that.
Yeah, please.
Absolutely. So all of these criteria can be contextualized. I think the definitions themselves say that you need to, which is the one criteria that is really important for contextualization, and that's the relevance. So if you get your relevance question, evaluation question, if you can find it in the program design, you will know whether this particular intervention, program, strategy has been contextualized. And if you're able to identify that, you will be able to assess how effective that was. Another question, policy compatibility, interagency cooperation. Well, interagency cooperation is through the coherence. We mentioned both internal and external. So if it is between two agencies, then it's going to be external, but it's still coherent. So that's how you would address that. I think you already have the answer in the question. Okay, we already answered who drove the change. I think when we talk about methodology, this is criteria. So methodology is part of your toolbox. So you can use different types of tools to assess any of these criteria. So that doesn't prevent you from doing any one of these. Yes, of course, the evaluators have power also, don't forget, as do the commissioners. And so if you are an evaluator, I would highly recommend you negotiate the terms of reference. I always do that, to include areas that have been missed out. And you will find sometimes commissioners are quite amenable to that. Any criteria has a limitation. One of them is that if you don't understand it well and don't apply it appropriately, it's not going to be, it's going to be a limitation. The other limitation is that if you don't address it to the purpose of your evaluation, If, for example, you are evaluating a program that is going to be looking at transformation, and you are just 1 or 2 years into the program, and you put in the criteria of effectiveness or impact or sustainability, clearly that's going to be a definition, a limitation for that particular criteria. Yes, long-term outcome and impact. Yeah, you know, this is a interesting one, because a long-term impact, a long-term outcome does move into impact, but impact is very high level. So when we look at impact, we are also going to look at external indicators and see whether there is an impact. So that is why, although we use the impact very, very loosely now, and with the private sector entering into the development, everything to them is impact. But I like to stick to the definitions that we have seen provided by the DAC criteria, which is very, very clear, something that lasts for a long time. And between outputs that you have and outcomes and then impact, we look at the logic model, you're going to have some variations from outcomes to impact. So yes, the longer term outcome, if long enough, will definitely be impact, but the indicators that you're going to assess impact are going to be higher level, and they are going to be coming from external sources. Any more questions? If there are, please put it in the chat box. I don't know if I've used up my 10 minutes. I wanted to come back to that cloud where I did mention, somebody had said indicator. Please remember that the indicators are not criteria. Criteria help you to develop the questions. From the questions, you are then going to identify how are you going to address that question. And at that point, you are going to look at your methodology, your tools, and the indicators that are going to support you to address that particular question that you have identified as a result of the criteria. So I hope that's very clear. Kuncho, you have your hand up again, or have you forgotten to put it down?
Yeah, I think she has forgotten to.
Okay.
Lower her hand. Okay.
I just, before I want to end this, I just want to know whether this particular presentation, Chodan has got her hand up, Kuncho. Please put in the chat box. Just before I end, I just wanted to also get feedback from all of you, whether understanding a very complex issue such as evaluation criteria was understandable to you. And if you have queries, kindly share it with our COE Secretariat, and I will be very happy by email also to answer your questions. Can we use monitoring data in evaluation? Absolutely. If it is available, if it is of good quality, yes. Even if it's not of good quality, it tells you something when you are assessing a particular program, intervention, policy, or so on. Because if you don't have good monitoring data, you are missing the middle block of the activities and the outputs. And it becomes difficult for the evaluator, definitely, but it is a critical area that one must look at when we are addressing the various criteria. So when we look at efficiency, effectiveness, if you don't have that data, it's very difficult to address those. I mean, the impact and so on is further down the line. So yes, monitoring data is absolutely critical, and the quality of it and the availability of it. And if you don't have that, you should decide which criteria is the most relevant for your evaluation and whether to have an effectiveness criteria, and if you do so, to what extent? Should it be at short term or long term, and to be able to constrain within those boundaries? I hope I've answered that question. Thank you. I don't want to take up the time of our next speaker, so I will stop here.
Thank you very much, Dr. Javeri. I think you have covered the topic very nicely within the time, and also responded to the questions that were there. Thank you so much. And now I will be requesting Dr. Alok Srivastava, who will be speaking about the guiding principles and ethics in evaluation. He has a long experience in evaluation, and he actually is director of CMS also at CMS. He's in a non-government, it is a non-government organization. He has authored many articles and papers, and he has trained development evaluators from international program and so forth. I now request Dr. Srivastava to make his presentation. You have about 30 minutes, Dr. Srivastava. Please go ahead.
Yeah, thank you, Dr. Jagdish and COE South Asia for having me for this today's session, especially to Malika ji, Rajiv, Chala, and Rajeshri for coordinating this entire day. So let me take you through. It was a very fantastic session by Sonal. And as a recap by Malika ji, she talked about the previous technical sessions that you had. Today, I'm talking more in terms of guiding principles and ethics in evaluation. So the previous session, or even the previous technical session that you had, was more focused on the technical specialty or the competency that is needed. And definitely when we talk about those things, those are very critical. So one can say that if it's the brain of evaluation, then what I'm talking about today is kind of soul for evaluation that one has to have if we are doing a good evaluator. And why do we need? The first question that arises, that why do we need some guiding principles for evaluation or ethics, is that we want to be fair to all and something that we are doing for the humankind. So for greater good, for the policies, the program that should benefit the maximum. And as we say that no one is left behind, leaving no one behind is our motto. So that guiding principles and ethics in evaluation helps to and ensures that. At the same time, it also helps to be accountable and transparent in our approach. When we say accountable, we need to be accountable not only to the donors and commissioners of the evaluation, but also to the public. That is more important, the general community. The guiding principles and ethics also helps us to be consistent and objective. There is no biasness in our approach. Whatever we are presenting in terms of findings of evaluation using the evaluation criteria or the questions that we are developing should be such that we are objectively putting our findings and sharing with the stakeholders. The guiding principles and ethics also help to improve our competency and professionalism in evaluation is also made through when we follow these guiding principles and ethics. In a way, what I would like to say that it's both important, the ethics of evaluation and ethics in evaluation. So when we say guiding principle, it's kind of ethics of evaluation that one should follow. And at the same time, when we go for evaluation there or we demand evaluation, then there are certain things that should be followed and we call it as ethics in evaluation. So the practicing of evaluation is what we are talking about in ethics in evaluation, and how you go about it, how you select your evaluator, how you do your evaluation is something that is ethics of evaluation. So those go hand in hand. Now, the first thing that I'd like to talk about is with respect to the guiding principles. And here, as we are talking about the skills that we need to have, the competency, that is very important in an evaluator. So whether you are part of a team or an agency or institution is doing evaluation, the team should consist of people who have the competency and professional skills to do evaluation. So the clarity of the criteria, the clarity of how to see the data, how to get the insights from those data and information is very important. And apart from that, the competency and professional skills also requires that one should be regular reader of previous reports, because that helps you to know what is happening, how the data and information are being presented. Take online trainings, because this COVID has also provided us a good opportunity to have so many online sessions where one can improve one's knowledge. So it's not only for young and emerging evaluators, even for experienced evaluators, it's a good opportunity to keep on learning, because as Dr. Jagdish said, that we are students still and learning. So that approach should always be there. It's not that after certain years of experience, we say that we are efficient and competent enough to do an evaluation. Another guiding principle which is very important is that we should be independent and impartial. So there should not be any conflict of interest between the evaluators and the organizations that is demanding. It should be independent as much as possible. It should be impartial in terms of looking into the data and information, the stakeholders with whom you are engaging. And that is very important when you go for a good evaluation. The second thing is, the third point is with regard to the guiding principle, which one should always follow, is to engage with the stakeholders and respect to participants. Engaging stakeholders is very important, whether we are doing a participatory evaluation, whether we are doing a third-party evaluation, not engaging community from the very beginning in evaluation process, but more as a information giving or as a respondent. There also we should ensure that all the stakeholders who are part of this intervention or the program or the project should be engaged in the evaluation, or they should be contacted and talked to, because viewpoint and information from each and every stakeholder is very important. And that should be one of the things that we should always encourage in our evaluation process and evaluation activities, assignments that we take up. Respect of participants, as I said, that apart from leaving no one behind, we should always think that they are the human subjects or the human participants in this evaluation are supreme. And we should also respect their views and opinion. We should not impose our views on them, but rather hear them. So we should be a good listener in terms of interacting with the participants, whether it is the program implementers, whether they are the general community people. Maybe they are not educated enough, but we should give them most respect and hear to their viewpoint or the issues that we are trying to capture in the evaluation. All these things are important, but at the same time, the systematic and methodological approach in evaluation leads to a good evaluation. So if we don't follow a systematic and methodological approach, if we are not clear, and there the competency and professional skills help. So these are in a way connected to each other. And these are the guiding principles which help to make you a good evaluator. So whatever evaluation, what level of, at what stage of program intervention we are doing it, accordingly we should decide our evaluation design, the evaluation criteria and question. How we are selecting our sample. There should not be any biasness and objectivity, what I talked about in the previous slide comes here. So the way you are using your evaluation questions and the way you are selecting your respondents and stakeholders for the evaluation or the data and information that you are looking at should be very systematic, and methodological approach should be followed for this. And of course, we have been talking about this and we expect every human being to follow it, but here integrity and honesty in our evaluation is key. Because if we don't be honest in our approach, in spite of having good skills, and in spite of following the methodological approach, we don't use the data and we try to hide something, then we are not giving a good result, not only to the commissioners or to the donors, but also to the people we are not doing a good service. Because after all, the beneficiaries or the people who are getting support from this, any program intervention or any policy that has been, you are evaluating, will only be good if it is reaching to the people or it is helping the real cause. So that's why we should be honest with whatever data and information we get during the evaluation exercise. And to get that, we have to be very methodological in our approach, and then only we can get good data. And how to interpret it, that is also something which comes with the competency. So that's why if you keep on continuing looking into the previous evaluation report, not only of that program or project, but of any evaluation report which is available in public domain or you have access to, that helps you to understand how to look into the data, how to present it, how to present the information whether it is primary data that you are collecting or the secondary data, secondary literature review that you are doing. So those are very important to help you in having the reports that you're sharing. And the last thing which I feel, but definitely it's not the least one, is that we are not only restricting ourselves or following the policy of no harm, because after all, whatever evaluations is being taken up is the purpose is to do good for the larger community. So those 6 panels, I would say, are very critical when we talk about the guiding principles or when we say about the ethics of evaluation. So these things one should always imbibe in our as an evaluator and try to see that how we can be a good evaluator right from the beginning till the end of the sharing of findings. So if we at all stages, we try to understand and keep ourselves open in terms of listening, looking into the data, listening to the people, we are always getting a good evaluation done. So that's very important, and definitely during the question answer, I can elaborate more into it, keeping the time constraint. The second thing which is very important, and as we know that in non-clinical research or evaluation that we do, ethics in evaluation is something like what we say that it's not kind of moral policing that we are doing, but we are trying to be honest in our approach and be a good ethical practice that we are doing. So here it's not mandatory in non-clinical research or evaluation. Like we see in the clinical research, it is very important to get your protocols reviewed from the ethical perspective. For that to be followed, what is very important that the evaluation protocol that once developed. And when we say evaluation protocol, I assume that you understand that, where you give an entire brief of the evaluation that you are trying to do, the context setting, the objectives of the evaluation criteria, and based on that, the questions that you are trying to put. And then coming down to the data collection methods, how you are selecting your samples, if you are reviewing the literature, that how exhaustive literature review you are doing, and how you are going to analyze these data, how you are going to use this information to build your evaluation report. Those should be all there in the evaluation protocol. And last but not least is even the evaluation protocol should talk about the team composition, how you are going to collect these data and information, how you are going to disseminate the information is the report. That is very important. Because if evaluation is being done only to keep the report in shelves, because that's many times possible. And as an evaluator, I understand that we have limitations, because after all, if we are doing evaluation for a commissioner, the person who has commissioned, or the agency which has commissioned, or the funders, then we can't force them, but we should try to ensure that these evaluation reports are shared with the stakeholders, because that is the learning process. You come to know, you share with them, they give their views and feedback, and that helps to not only the policies and programs that you are evaluating, but also to do a kind of, gives you a feed forward to improve make the corrective measures in the program interventions that you are evaluating. I am trying to mix certain things because today we may be working, or as a professional, we could be an evaluator, but after a certain point of time, we could be on the other side of the table. We could be commissioners of evaluation. So that is very important that when you select an evaluator, you have to be very honest, and there you have to see how you are selecting an evaluator or evaluating agency or team of evaluators. That is very important. So the set guidelines should be fair to all the bidding evaluators or consultants. And that is a very important thing in terms of ethics to be followed. Many times we say that the third party evaluation is being done, but it is something being done internally. So that should be avoided and that should be seen. So a detailed TOR, terms of reference, or request for proposal for the evaluation should be there. And there should not be any conflict of interest between the commissioner of evaluation and the evaluator. So, because there, if we have that, then the chances of integrity and honesty in putting the data or the findings or the report may get affected. So the biasness should be not there, and there should not, because if we are calling it as a third party or independent evaluation, then it should be, and it should not only look like, but it should in real terms be the independent evaluation. The fourth thing which ethically we should ensure, and as I'm trying to repeat it, that these are not something which are mandatory. Maybe in evaluation criteria, as Sonal mentioned, that we should look into the gender perspective, that gender equality is being followed. But even if it's not there, or you should have in your protocol that there is no discrimination in selection of participants or even evaluators by the commissioner. So when I say no discrimination, then you should ensure that the marginalized community, if it is getting affected from the program or the policy, they should be talked about or talked to during the evaluation process. Then the gender discrimination should not be there, because you should not think that, okay, it's easy to talk to certain group of people, let us go and talk to them, get the findings and present it. Then the findings will not be real. So we have to look into who are the people who are getting affected, and irrespective of gender, irrespective of age, irrespective of the social group to which they belong or their educational qualification, everyone should have the scope of randomly getting selected in the sample, or even if we need to have some stratification in selection of sample, we should ensure that there is representation of different groups, whether it's by gender, by age, by education, and we talk to them, we get information from them if it is primary based evaluation that we are doing. Or if it is secondary, then we should also talk about the limitations if those data are not available by these different profiles, what I say. Similarly, in terms of evaluation, it is very important the evaluator team should have the gender balance. Because we know in terms of the cultural norms that we follow, in particularly in South Asia, that gender balancing is very important when we have a team member, female talking to female, a male talking to male on certain sensitive issues, maybe it's public health issue if we are talking about, or child labor. Then if you have the gender balance and gender matching, then you ensure that the good data you get. So these are some of the things which is very important and may not occur to us when we do evaluation. But if we keep these things back in of our mind and ensure that these are being followed, then you are ensuring that your evaluation is good. Again, when we go to and talk to people of different profile, we sometimes feel that the moment we go and talk to them and they agree to be interviewed or participate in the survey, their consent is there. But it's not so. You have to be very proper consent you need to take from them. You have to explain the entire objective, and I will be talking about these things in the following slides. So how you should have your informed consent form and whom you should take the permission if you are talking to a minor. The risk and benefits should also be shared with participants, because they should know that if they are participating in it, do they have any risk of getting, if they don't participate, is there any risk? If they are participating, then what benefits they are getting, or if they are not getting any benefits, those clarities should always be there when you are talking, and this should be told beforehand you start the interviewing process with these stakeholders. Very important is confidentiality and privacy. So along with informed consent, we have to tell them that the confidentiality and privacy will be maintained, and this should also be ensured. Their names, their personal identifiers should not be put in the report unless until we have their consent or something we are quoting them as a verbatim. So we should take their consent. The photographs, even the photographs, we should not use without the consent of the participants. These are very important things, because if you have a good rapport, you tell them these things and they participate, then the honest reply will come to you. And that is very critical when we are doing an evaluation. If politically correct responses are coming because they fear that what they are saying may be told with their neighbors or with the community leaders or the government officials, and they may get affected, because the frontline workers or the people who are providing them those programs and benefits may feel bad if they are telling something about the program which is adverse to it or the policy, then they will not give an honest reply. Along with that, I feel that the data protection and policy should also be ensured. The data for the purpose we are doing evaluation should not be made available in public domain unless until it is being permitted, because that could be misused. A selective portion of the data may be used from the data set that is available with you if it is in public domain. And that misuse will going to hamper the program, will going to affect the people who are getting benefited or even implementing the program. And the last thing that I said in the previous slide is dissemination of evaluation, sharing of evaluation, if I call it differently. So those are very important. You share it with all the stakeholders, get their views and opinion, and that helps you to know that where more information or gap is there, and then it helps you to improve the evaluation findings or supplement it with more data in the future evaluations that you're doing. So that helps your skill also, and that helps that particular evaluation. As we all know, why we are talking about these things is that ethics basically is about distinguishing between right and wrong. So this may vary from country to country, context may be different. There could be different social norms, cultural norms that has to be followed, and that should be respected. And that is why there is no definite or standardized, other than what I talked about in the previous slide, has to be contextualized and adapted according to the scenario, the context, or the place where you're doing your evaluation. But what is important is that human participants are supreme. They are the nucleus of evaluation. Whatever evaluation you are doing, whether directly or indirectly concerning them, but they should be always kept the main focus of your evaluation. Again, the participation of stakeholders, I said, is very important. I am trying to repeat certain things, but these things many a times get omitted or left out. And that's why the evaluation that is presented is not very objective and is not providing the real picture to say that where the program or policy is going to affect or has reached in terms of outcome or the impact that is going to make. Whether we are doing, when we are talking about attributing certain things, then are we doing right thing if we are not skipping or excluding someone from the evaluation process? Particularly with the minors or the pregnant women, differently abled, or the people with disability, these get omitted in the evaluation process. They are not mentioned, or their opinion and views are not taken. So we have to ensure, and these are sensitive categories of people, we need to ensure that if they are getting benefited or they are part of the population, the target population whom this program or policy that you are evaluating is benefiting, then we should include them in our evaluation process as well. More details in terms of the evaluation protocols that I talked about. It should conform to the evaluation criteria. A detailed literature review is very important, and relevant data and information should be looked into and should be reported in the terms of reference itself if it's a secondary data. The evaluation design and approach should be justified in the protocol. Even the ethical consideration, as I said, that it's not mandatory, and many a times people don't get ethical review their protocol, but it should be detailed out as much as possible. What ethical considerations when we are going up for a evaluation or interacting with the population after COVID or during COVID, the COVID appropriate protocol should be followed, and this should be laid down in the protocol itself, that the team who is going to interact, how they are going to handle this sensitive issue. If you're going to a household where some death due to COVID has happened, how you're going to handle that scenario? Are you going to still impose your evaluation, interviewing them, or you will try to pacify and move to some next respondent? Those things are very important to be told beforehand in the protocol that you are developing. The terms of reference should be very detailed out because that helps in your evaluation process, and also the evaluation protocols get benefited. So it's for the commissioner also to ensure that the terms of reference should be as detailed out as possible. And then only a good evaluation can be taken up. These are some of the things in terms of not only the minorities or the pregnant women, but some of the new groups which many a times get left out, like the LGBT community or the primitive groups. If you are going to a tribal population, if they are living in remote locations, they should be part of the evaluation process. They should be interacted with. Even when we say about good ethical evaluation, ethics in evaluation, we should try to do a minimize possible harm to environment. When I say that we should avoid wasting too much taking printouts. Now we are working more on the computer. So we should avoid doing those things. Look for already available data, as somebody talked about monitoring data being used for evaluation. So why should we again kind of replicate if we have some indicators, data available on some indicators? So that will help the resources that is being used for collecting those data. But evaluation goes beyond monitoring is also to be kept in mind, because we try to know what, how, why happening, which monitoring data may not provide. The interest and privacy, as I repeat again, needs to be very important from the ethical perspective. And these are very important for the team and the evaluators to follow. I have been talking about it in terms of not going for the personal identifiers, not talking about the participants in the report without their consent. The duly consent form should be taken from each and every respondent that you are talking to. Keep your data in a protected place and should not be put in an open space where anyone can have access to other than the evaluation team. Even on nowadays, because of the COVID restrictions or otherwise, we are going for a lot of online and telephonic surveys. So there you get many personal identifiers, or even you record it, but without consent, that should be avoided. The personal identifiers or the phone numbers that are available with you for your team, you should ensure that that is not being used for any other purposes. And these are some of the things you have to be very careful, because you have huge set of contact details and that could be misused. The data that is available with you should be kept in a protected, password protected computer, so that nobody other than evaluation team should have access to it. And you may be, many of you may be following it, or if you are young and getting into this sector, our suggestion as a somewhat experienced evaluation is that these are very important, and many times these are being misused. And that's why we have to be very careful when we are doing evaluation and using the data. Although the informed consent, which I talked about earlier, is voluntary, but it also provides an opportunity for the respondent, and that gives, if you detail out the consent form, then you give them the opportunity to refuse to participate in it or refuse to answer any particular question. You can't force him or her to participate in the survey. So they can adopt and say that they can want to discontinue with the interview or interaction, but they should not be deprived of any benefit from the program. So the entire consent form should talk about the objective of the evaluation, why you are going and talking to the person, why you are collecting the information, what is your institutional affiliation or for whom you are doing this study, what is the objective, what are the benefits. And so these should be detailed out in the consent form that you are using to get the data, whether it is online or whether it is face-to-face, virtual, whatever way you are collecting data, the consent should be taken from the participants. And it should be in very easy language. As I said, that demographic profile may vary and you're talking to a very less educated person. So it should be in such a easy language that they should understand the purpose and the objective of the entire thing. And if they have any concerns, they should ask you or the person who is collecting in your team. if you are doing a study on child labor and you are talking to the child who either is in child labor currently or being withdrawn from that, is a minor, then the consent of the parent or the caretaker or guardian is very important. Along with that, you should also take the assent of the minor. So that's why when you're talking to a major person, you say consent, but when you're talking to a minor, it's assent. So first you should take the consent of a major person, the adult who is guardian or parent of the child, and then you talk to the minor. And also inform them briefly in a very easy language that why you are doing this study. Because then only if you're talking from the school benefit program or anything that they are getting for example, midterm and mid-meal, MDM, what we call midday meal. So if you're talking to that person, it's very important that you talk to their parents, you take the permission of the institutional head, and then only go and talk to that child. So these are very important things that has to be kept always in mind. And just to give you a snapshot of the template of kind of consent form that we follow or use, and this could be revised and adapted accordingly. But as I said, that we should talk about introduction, give the introduction in terms of your affiliation, your name, the institution, the purpose of the study, and procedures that you follow. And if the person is not able to sign it, then it will be verbal consent, but an undertaking should be given by the evaluation team member that I have read out the entire thing and the person has agreed, because the person may hesitate, and it happens in India and I think in the other South Asian countries as well, that people don't want to put their signature on some document if they're not so well educated and they fear that why they are putting their signature. So in that case, verbal consent is equally important. Only given an undertaking or a witness should be there who should say that the consent has been read out and the person has agreed to participate in the evaluation process as a participant or as a respondent. This is very important. I have been repeating it, that dissemination of findings in terms of looking into the data, presenting it, and sharing with the stakeholders is important. But what I am trying to focus here is upon the zero tolerance. We should not use data from anywhere else and put it in the evaluation report that you are presenting. The data fabrication should not be there. And these are ethical things. As we talk about, honesty is the best policy, but we should ensure in ourselves as well. Because if you are trying to attribute or use the data from somewhere else and contextualize and putting it here, then those should be avoided, and there should be strictly, there should not be tolerance to that. The sponsors of the study and other things also should be important to be mentioned in terms of limitations of the evaluation. If you are getting data from certain houses or certain sources, that should be mentioned. Acknowledgement of the contributors is very important, because as I have been saying from the very beginning, that you have to acknowledge and you have to say that the people who have participated in this study are very important in terms of acknowledging their contribution to the evaluation process, and those should be put in upfront. Certain things where, apart from evaluators, I say that maybe in future you will be a commissioner or a sponsor of any evaluation. So you should get your evaluation protocols or the terms of reference reviewed. Ideally, it is evaluation protocol that should be reviewed by an independent ethical review committee within the organization or an external body. That is desirable. And in fact, I would say that ethics in evaluation, the entire thing is desirable. It's not mandatory. The terms of reference should be very elaborate. And if you are doing that, then only you are trying to compare apple with apple, and rather than doing it apple with oranges. Because if you are not very detailed out in your terms of reference, then you are giving preference to certain evaluator who has understood the terms of reference differently and has given certain resources that has to be put there differently, and you are selecting it on that basis. Many a times we have noticed in our experience, that lowest financial bid should not be given the key criteria in selecting it, because technical thing is equally important. Just saving the resources in terms of finance budget for evaluation should not be there. And of course, again, for that conflict of interest in selection at any stage must be avoided, I would say, because then only you will get a good evaluation and good evaluation report. In fact, again, from the ethics perspective, we say that corrupt practices in terms of influencing either the evaluation or the evaluation findings should be avoided. And the person should be disbarred or disqualified from the entire process of evaluation if you come across anything which has to do with these unwanted practice. And with that, ethical clauses should be clearly spelled out in the TOR or the request for proposal itself. And that will be helpful in controlling and getting a good and honest report or the evaluation that you're conducting. I think the slides will be shared with you. So these are some of the reference materials in terms of looking into what more when we talk about the guiding principles and ethics of evaluation. So it's a mix of some of the reference materials which will be helpful to you, I hope. And now I think that's my last slide. Thank you. And I will stop sharing here and will be open for any queries, any questions that I may respond to.
Thank you, Dr. Srivastava, for very interesting, very detailed presentation. There are already few questions in the chat box. Maybe you want to pick them up.
Yeah, and I'm just trying to start from where I have to pick.
Did you say it?
Okay, yeah. I think from Sanjani is the first question that I have, if I'm not wrong. Do we need to get approval from Ethical Review Committee to conduct an evaluation? Well, as I said during my presentation, that though it's not mandatory, but it's always a good practice. What is happening in social research or evaluation that we are doing, or even that non-clinical research and evaluation, there is no compulsion to get your protocol reviewed. But it is always good, and people who want to use these evaluation or the research that they are doing for going for a peer-reviewed journals or publication, then they get it reviewed by an ethical review committee. So it's always good because you get a third perspective on it.
Okay. Any other questions from the participants? Okay. Now there is one question I'm always puzzled with when it comes to ethical part. Dr. Srivastava, maybe you can share.
Yes.
When we interview people or do our surveys, oftentimes we say, all right, we'll share the findings with you once it is ready, all right, or published. But my hunch is that most of those reviewed or those who were interviewed never received that report. They don't know what was reported and what was written. Do you see there's some kind of ethical problem over there? How do you see it?
Yeah, I think this is very important because with the people or the stakeholders with whom you have collected some information or data, the findings should be shared with them, because that also gives them a kind of ownership of those evaluations that is happening. But as an evaluator, we feel that because we are doing a time-specific assignment or job for the commissioners, they may not be in the process of sharing it. But that should be an effort of the evaluation community to always keep on talking to the commissioners or the institutions for whom we are doing this evaluation, that the findings should be shared, because there are no personal identifiers. And when we say that evaluation is a learning process and we are not doing a policing or talking about right or wrong, it's a learning process. So we should share with these stakeholders the findings, and that will help in making the program more better in terms of reaching to the target audience.
Thank you.
So I agree with you that we have this constraint that we may not be able to share with all the stakeholders, particularly the community, but our approach should always be there when we talk about this issue with the commissioners.
There is a question in the chat box. Please have a look.
No, it's not mandatory. As I said, that if they are the beneficiary of the target intervention that is being made, then we should talk to them. And it's sometimes they are not the intended beneficiaries. They may be the unintended beneficiaries in the family or the households who are getting benefited. So their perspectives get missed out, because when we go and talk to the head of the household or the main person, we don't get their perspective of a pregnant women or the people with disability, how the program is really helping them. That's more at the individual level or at the household level, the information is collected. So if we ensure in our approach that we have representation of these people in the program, maybe as an unintended beneficiary, then we are going to get some more insights for the program and policy. That's my take on it.
Thank you. Any other questions? Yeah, please put it in the chat box, please. Sandamali. Sorry, yeah.
I think, yeah, I have responded to her.
Okay, you have already. Oh, no.
Yeah. It was related to the PWDs and pregnant women.
Okay. Okay. I see that there are no hands. I see hand. Mallika ji, please.
Yes. Now, in some cases, it is mandatory that we get the consent from the ethical review committees in various countries, including our own South Asian region. We have what is called ethical review committees attached to an academic institution like a university. So when we start on a sensitive kind of a survey, it is mandatory, especially with children, no? It is mandatory that we go through the ethical review committee's permission. So
Yeah.
How do you look at that?
Yeah, it's very important. And if that is being practiced in Sri Lanka, nothing like that, I really applaud that approach. Even in India, and if you may have noticed that I am part of one of the ethical review committee that we have in CMS. So it's one of the few organizations that is having an institutional review board, and it's not only internal review that we do. We also ask other institutions or evaluators or researchers who can come to this board, CMS IRB, to get their evaluation or research protocols reviewed by an independent body. So they can get their protocol, and it's mostly in case of public health issues or people who want to have some publications. But it's a good practice, even though it's not mandatory, that one should get their protocol reviewed by an independent ethical committee.
Great. Rajshi,
I have one more question, if you don't mind.
Yeah, please.
Hello.
Yeah,
Now,
please.
Sometimes it depends on the method that you use for the evaluation. If it is a community participatory evaluation, then there is no need to get this committee concurrence, because it's open for everybody. But it is not with everybody that we can do it. Now, in Sri Lanka, for example, if you are conducting a survey with children, underage children, we have to get their parents' consent. There's a particular form where we have to get their signatures, and it's explained to the children. And if they prefer, we allow some parents to remain with us when we are conducting the survey. But with the elder people, with the elder children, adults, it can be an open, participatory way of methodology that we use for the evaluation. I emphasize the methodology of the evaluation, not just the evaluation. How we do it. What is the scheme that we adapt? It makes it transparent by that methodology itself. What do you think, Carlo?
Yeah. What I feel is that, as you slightly said, and I talked about it, is that minors, before we talk to them, the consent of an adult person from the family or the guardian is compulsory. Apart from even informing the minor or the child, like in India, we have below 18 is a minor. So you take the permission of the guardian if the child is below 18 years, the person is below 18 years, but also inform the child that why we are doing in a very simple language. So a kind of, you are informing the person that this survey is being done and the information is being collected from you. Your name will be not, suppose it's something to do with the school. So you will say to that child that whatever you share with us will not be shared with your teacher. So that confidence has to build to get an honest reply. Similarly, in the case of community participation in the evaluation process, there could be a scope for kind of evaluation or the certain things being very sensitive, and people may not share in open about the program or the project, whatever measures or initiatives you take. So if you are doing a group discussion also, there needs to be a consent, and that we are doing an audio recording of the entire process. Your names will not be disclosed unless until you permit us. We will be taking some photographs of this session, so your permission is there. And your ways and the information that you share will not be linked with your personal identifier. So those things are a practice that needs to be followed and told to them as a way of consent from the participants, is what I feel. Am I being able to answer?
Yes, of course. I'm just trying to place it in context.
There are two questions in the box. Maybe you want to pick them up. Dr. Srivastava. Rajesh has posted.
What are the different ways to minimize possible harm to the environment while doing studies? Yeah, of course, there are certain limitations, because if you're traveling, definitely you can't avoid traveling in a vehicle. But the kind of vehicle that you are using, you should ensure that it has the pollution certificate, that it's not polluting the environment. And other things, as I talked about, is that in terms of resources is more to do with the evaluation data that you are collecting. Many a times there are wastage of printouts people take out nowadays and look into. So those things can be avoided. The carbon footprints, what I say, are the things that, even the servers that you are using or the computers that you are using, if those are the latest ones, then they consume less electricity. So as I say that these are ethics one should follow. It's not mandatory. Nobody may come to see which computer you are using, but certain things that you can keep on practicing and minimizing or contributing to the good of the humankind or the environment should be practiced.
That by itself is ethics.
Yeah.
And plastic bottles, of course. You don't carry plastic water bottles and throw them everywhere.
And throw it here and there, the wastages, while you're in the field.
There is another question by Rajesh again.
I think this is, will the speaker share with us a few evaluation reports that cover a variety of different needs so that we could use them as reference points in our work? So what kind of reports? Maybe if these are in public domain, they can be shared with them. Not only the evaluation reports done by us, but There are many UN agencies who keep their reports in the public domain. Government also puts certain evaluation reports from time to time on their website.
UNICEF,
So,
very much.
yeah. So if you are interested in any particular sector or theme, you are looking into child education, then just look into those organizations who are closely working on these issues. If you are looking into public health issues, then you can go for those organizations, or even the ministries have these reports in the public domain. This is what we are trying to promote and talk about it, because if you put these reports in the public domain, the findings will also improve. Because if you read it, you learn from it, get the insight and see the gaps in the report, then you can improve in your next report or the report that you are working upon. So it's a two-way process. For the ministry or the institution also, they should put in the public domain. People can learn and the evaluators can see it and use it to improve their evaluation reports, because evaluators are also not perfect, to be honest. So they keep on improving themselves.
Okay, very good. Any other questions, queries? Otherwise, I will start wrapping up and then pass on to Mallika ji to close the session. Any questions? No. All right. Thank you so much to very distinguished practitioners of evaluation and member of COE South Asia. They have presented. I'm sure the participants have benefited a lot. And I would like to suggest that if you have any questions or you need more information or some questions that you have, you might want to address, you can always send a question to our secretariat, and especially to secretariat manager, and she will then pass on to other members. So that option is there. I know what several things to carry on, but evaluation is a profession. It is evolving. Even the criteria, indicators, even the so-called science and method is evolving. I think that is the lesson and the story that we heard from Dr. Sonal Javeri, and regarding the criteria, indicators, and how they actually measure the impact and efficiency. I think it's a very important part. The more we do practices and start writing and analyzing, then we'll realize how much one is related to the other. So I think it's the deeper we can go deeper and deeper. It's a learning process. So the learning component is very important in the evaluation. I think that is something we should keep in mind. On the ethical and guiding principles side, Dr. Alok Srivastava, very detailed presentation. And I think those who want to practice and who are emerging as evaluation practitioners, they will find it oftentimes difficult to follow also. It's a whole thing out there when you face the reality. But still, I think the message is we should stick to ethical those questions and those values that we want to promote, even if it is difficult and it sounds very ideal. There is no enforcer here. There is no enforcer here. It's a self-imposed. So this is where the test of ethical part comes in. As a professional, to what extent we follow it. And then, of course, these some of the institutions which might help for ethically review certain protocols. But again, that is not so widely practiced. It is more on the practitioner side, how much we abide by those values. With these notes, I thank Dr. Sonal Javeri and Dr. Alok Srivastava. Do you have anything to add to what I have just said to the participants? Something one-liner, maybe, both of you.
I just want to wish all our participants the very best as they embark on their evaluation journey. It has its highs and lows, but I must say it is eminently satisfying. It's eminently interesting, full of surprises, and you will enjoy it.
Thank you. Dr. Srivastava.
Thank you to COE team and to participants for being here with this session. And as Dr. Jagdish said, that is self-regulation is very important if we see from the ethical perspective, but still we should keep looking for the best that we can provide. That's all from my side.
Thank you.
All the best. Thank you.
Both of you. It has been a privilege to moderate this session, and such an excellent practitioners, both of you, Dr. Zaveri, Dr. Srivastava, thank you very much, and wish you a very wonderful Dussehra and Deepavali.
To all of you.
Okay. Now, I pass my to Mallika ji, please. Go ahead.
I think I have no words to express how much grateful I feel about the two presentations. And of course, before that, I must say, the people who signed in, I was watching, they continue to stay till the end of the program, which means people were quite interested in what you were talking about. That by itself is a compliment to Dr. Sonal Zaveri and Mr. Alok Srivastava. Sonal, in particular, I would like to say that I appreciated your interactive way of trying to carry that message to the participants. I'm sure they enjoyed it by putting those numbers and looking at it, so it became lively. So we should also continue to see how far we can get the participants to interact so that they don't get bored. With regard to the presentation by Alok, I think he made it so internalized by the people who are listening that there was no other explanatory session needed for that. It by itself touched the life of many people, and especially when it is evaluation, we have got to be conscious of, that's why I said about this participation, the consent to be got from their parents, teachers, when we are conducting these evaluations for minors. It is also the way, the method that we conduct it to make people feel free to express themselves. So I think those ideas have been very well conveyed by Sonal, by her activity itself, and by Alok, by reflecting on how best we could handle it. Thank you so much. And I have no words to compliment and thank Dr. Jagdish Pokral for carrying through the conversation and moderating the session. And also I appreciate his impressive remarks at the end when he was mentioning, though there were few words that went a long way to the hearts of those who are interested in evaluation. Thank you so much. And also for moderating the sessions. I think we have kept to the time. That is also wonderful in a way. With the little time left, I like to congratulate all those who participated and stayed through. And I appeal to them to continue with the next two sessions. With these 4 technical sessions that we had planned for YEEs. So YEEs mean the young and emerging evaluators. So the world is open for you to learn and grab every opportunity that comes your way, because that becomes a learning. And even Robert Chambers says, once at a session we were asking him, can you explain the most important thing in participatory methodology? What is it that we have to convey? He said, I need a little time for that. Let me come back tomorrow because you are still there and I will share with you. So everybody was very eager and he brought a book. Then I said, I have one book now, but I can place orders How many of you need it? Almost 90% were raising their hands. Then he said, wait a little, wait a little. I will pass this round, and after that, please tell me how many copies you need. He passed it round. And what do you think was there? A good guess from someone?
An exercise book?
Sandamali, are you speaking? Okay.
I was still in an exercise book or like book with empty pages.
Uh-huh. To give
Book
that.
with yeah, just to like, let me type.
Okay. What was written there was, it was a thick book, nicely bound. And in the first page, when you turn, it said, use your own judgment at all times. In other words, what he said was, there is nobody who can recommend something. You have to use your own expression and adapt yourself to the situation. I thought it was a lasting message to everybody. So I like to end this discussion with that, with all respects to Dr. Chambers. Dr. Jagadish?
Yes, would you like to close now?
I think it's time. It's sharp on time.
Thank you.
Thank you. Good
Thanks
luck.
everybody for participating. Please continue for the next 2 sessions.
Yeah.
Next session is on participatory methods. So let's see how they look like.
Okay,
Thank you.
thank you. We look
Thank
forward.
you. We learned a lot.
See you in your next session.